All right. Hey, everyone. This is the Dissociative Disorders notes. So here we go. Sorry if I sound tired. It's like 1 a.m. right now. So here we go. So, what are the dissociative disorders? So, it's a category where uh, people experience dissociation, meaning they feel like a separation, whether in consciousness, memory, emotions, their perceptions, motor control, or identity, to the point to where the symptoms are pervasive, meaning like overtaking their life. They cause significant distress and they interfere with their daily functioning. So again, it's this idea of dissociation, meaning like feeling separated from yourself. So they include dissociative amnesia, which includes a subtype known as dissociative fugue, something called depersonalization-derealization disorder, and the one that I'll focus on the most is dissociative identity disorder, formerly known as multiple personality disorder. So here we go. Dissociative identity disorder, a lot of times you see it abbreviated as DID. So what is dissociative identity disorder? So it's a disorder characterized by the presence of two or more distinct personality states or an experience of possessive trance, which gives rise to a discontinuity in the person's sense of self and agency. The most thing that you hear about is this presence of two or more distinct personality states. The number of these personalities that someone has just depends on the person. Just to qualify, they need to have at least two distinct personalities. Remember, like I said in class, this is different from schizophrenia, so it's not just simply having auditory or visual hallucinations. It's literally like there's two or more people in one body. So everything is distinct, including it could be different gender, different voice, different skills, etc. So symptoms of dissociative identity disorder, criterion A. Again, it's characterized by two or more distinct personality states, which may be described in some cultures as an experience of possession. This disruption of identity involves marked discontinuity in sense of self and sense of agency, and it's accompanied by related alterations in affect, meaning how people are displaying emotion, behavior, consciousness, memory, perception, cognition, and or sensory motor functioning. So all of those, it's like having completely separate everything is pretty much what this is saying, except separate bodies. These signs and symptoms may be observed by others or reported by the individual. Criterion B is recurrent gaps in the recall of everyday events, important personal information, and or traumatic events that are inconsistent with ordinary forgetting. And why that happens is while different personalities are the one in control, that might cause the other personalities to have these gaps in memory. Criterion C, these symptoms cause clinically significant distress or impairment in the person's life, whether it's their work life, school life, home life, etc. D, what's being described is not a normal part of a broadly accepted cultural or religious practice. There are some cultures where dissociation is encouraged, so this would not be diagnosed in a culture like that. And E, the symptoms are not attributable to physiological effects of a substance or another mental disorder or medical condition. So contributing factors of dissociative identity disorder, basically what might the cause of this be? If we look at it from a neurological perspective, from a biological perspective, we do know that people's brains respond differently on a PET scan to hearing the person's trauma story, depending on which personality was in control. So, for example, if we had the PET scan with the alter, is what they're called, with one alter that experienced trauma, and then compare that PET scan to another alter's PET scan who did not deal with trauma, we would see different results. The problem with this, and what makes people skeptical, is there's no control group to really compare them to. And what we know about hypnosis, can also alter brain activity. So some researchers think that DID is kind of a sort of self-hypnosis. Remember, like I said in class, it is highly controversial. Psychological factors, we know that it's seen more frequently in people who have a high rate of being able to be hypnotized and in people that can easily disassociate. So these people can enter like a trance-like state really easily, or they experience depersonalization or derealization. Social factors, we saw kind of a cultural phenomenon happen in the 70s in US culture after a movie came out called Sybil in 1976. Just fun movie fact, she was played by Sally Field, if you know who that actress is. Anyways, the true story that the movie was based on came out to be false. And I think I talked about this in class. But basically, the therapist exaggerated what happened. The therapist suggested to Sybil that she name different parts of her personality, but in no way was there actual disassociation happening with the client. Another contributing factor is trauma. Most people say that at least one of their alters has had a traumatic experience. Think of this like if someone has trauma, people often report like disassociating, like trying to separate themselves from what was happening to them as a sort of coping mechanism. So this could be kind of an extreme version of that. Treatments. For medication, it's not really used to treat symptoms. Research shows that it doesn't really do anything to help, so we don't want to medicate for someone for no reason. However, sometimes medication is used if someone has a comorbid or concurrent condition like depression. Another type of treatment is known as coping or integration, but really it depends on the theory that the clinician accepts for why this happened. Some people try to map the trauma, meaning have the person kind of relive that trauma so they can address it and face it. Other people use learning principles to try to extinguish mentions of alters. Some people use hypnosis, means to reduce traumatic stress. But again, no real medications for dissociative identity disorder. The controversy over it is, does it actually exist? So here's what we know, that severe trauma can lead to dissociative disorders, but we don't know if all people diagnosed as having DID have actually experienced trauma, or how traumatic does an event have to be to actually send someone into this state. We also know that just because someone experiences a traumatic event does not specifically cause DID. Okay, another dissociative disorder is dissociative amnesia, or a subtype is dissociative fugue. So this I'm not going to spend as much time on. So what is dissociative amnesia? Or in your box, I think I have dissociative fugue. This is where you'd write it. So it's a disorder where the sufferer has significantly impaired memory for important experiences or personal information that cannot be explained by ordinary forgetfulness. This is a rare disorder. The subtype, and I think one that's kind of interesting, is dissociative fugue. This is where someone has sudden unplanned travel and difficulty remembering the past, where literally people have ended up like across the country with no idea how they got there, who they are, or why they're there. People with dissociative fugue will describe like family members, like one day they're home and the next they're gone. So kind of strange how that happens. Okay, now changing gears, the somatic symptom disorders. And again, this is not in your book, so you want to pay special attention. So somatic symptom disorders are people complain about their physical well-being along with cognitive distortions about bodily symptoms and their meaning. The focus on these bodily symptoms causes significant distress or impaired functioning. You can see here a list of common body complaints that people might say they have issue with. We're going to talk more specifically about conversion disorder and illness anxiety disorder. So conversion disorder involves sensory or motor symptoms that are incompatible with known neurological and medical conditions. And this is key, this idea of sensory or motor symptoms. There's actually a somatic sensory disorder, which is a different thing. This is the key words, though. You may want to underline these. This is what makes conversion disorder different. So here are the symptoms. So criterion A, a person has one or more symptoms of altered voluntary motor or sensory function. So motor symptoms would include things like tremors or muscle spasms. Sensory symptoms would include things like blindness, double vision, deafness, and third might be seizures. Criterion B, the clinical findings provide evidence of incompatibility between the symptom and recognized neurological or medical conditions. That's a really nice way of saying we see symptoms in this person, like literally we can see them having tremors or muscle spasms, but when we run tests on them, we don't see anything wrong. Criterion C is the symptom or deficit is not better explained by another mental disorder. And D, it causes the person distress, whether in their work, job, etc., school. And illness anxiety disorder, so formerly known as hypochondria or hypochondriasis. So what is this? This is a disorder marked by a preoccupation with a fear or belief of having a serious disease in the face of either no or minor medical symptoms and excessive behaviors related to this belief. So some of the symptoms of this include a preoccupation with having a serious illness. No somatic symptoms can be present to be diagnosed with this. The person has a high level of anxiety about their health. The person performs excessive health-related behaviors, like they're going to the doctor all the time. And illness preoccupation for at least 6 months. So this preoccupation with having a serious illness, this might be someone has something really simple, a cold or something like that, but they take it to the extreme. Like they barely feel sick and they now have every disease imaginable. And that is the end of the notes. I know on these I didn't really go into the causes that much. Somatoform disorders usually aren't emphasized very much, but I wanted you at least to hear the names and get some of the symptoms written down. Hopefully you have time in class right now, since I'm not there, to watch the video. If not, it's posted on the agenda, particularly the one on conversion disorder, so that you can watch that and see that in person. Anyways, have a good day.